Good afternoon again. Everybody is here. Thank you. So we can now think about the diagnosis. How an Ayurveda doctor diagnoses. We can go through some theory, and maybe I may give you the our case sheet, history of disease. Yeah, how to take the anamnesis, medical history of a patient. So there are so many factors we are looking. So we have our case sheet is look like modern medical case sheet. Yeah, we are looking so many physical examinations just like modern medicine, but there are some unique factors and unique findings we should check through Ayurveda, by Ayurveda knowledge. So it may be functional, it may be structural, maybe concept of immunity and strength, it is the season, it is the digestion, so and the constitution, age, mental condition, state of disease, then we have and the habits. So diagnosis basically, I told you, two ways. One is the assessment of the patient and the diagnosis of the disease. So our method of consultation is of course, Ayurveda is also saying about what is diagnosis? How we can get into a diagnosis? Can you tell me how to get into a diagnosis? What are the method of diagnosis? As a doctor, there are doctors in this hall, there are doctors or the paramedical staffs also in this class. Can you say how to reach a diagnosis? How we will diagnose? So diagnosis is nothing but our perception by our knowledge, by our experience, and by our science. Science is so in Ayurveda there are so many things to diagnose. This is, I write some Sanskrit words. This is Pratyaksha. That is what we can see. Yeah, that is obvious. What we can see. Then Anumana. That is the hypothesis. So we are seeing something and we think it may be like that. For example, if somebody see an iceberg, yeah, most of them know that 95 or 99, at least 90% of the huge mass of iceberg is under the what we see on the sea. Yeah, that is the Anumana. We think if the pain comes in the stomach, it may be like that. If it comes soon after food, what is it? It is usually the gastritis. And if it comes about 1.5 hours during the stage of digestion, when the sphincter releases, when the gastric evacuation times ends, yeah, it passes through the digestive canal and it may digest duodenitis. Yeah. So these are the knowledge and what we are making the hypothesis. Then what is yukti is logic. So anyway, we want to get into the logic. This is the third thing of to be diagnosed. Then Apta Upadesha. So according to Ayurveda, Apta is the man who knows everything, or the scholar. The advice, Upadesha means etadva words Apta plus Upadesha. Upadesha is the advice. Advice by the scholars. So these are the known as the postulates to get into a diagnosis. This is the science, this is our logic, and this what is the obvious thing we seen. It is written in Signs and Symptoms, and this our inference we made through the hypothesis. These are the things we get into a diagnosis. But can you see how the diagnosis is done in olden age and even now? There is no difference. How we perceive it. You see, the diagnosis, okay, of course, obvious thing, by hypothesis, by logic, by science, what is written in science. So how we see it? If one patient came to an Ayurveda doctor to the consultation, of course we say, yeah, one lady came to me and says she has Vata, yeah, and one another she has Pitta. Today we taken all the three constitutions, and one gentleman was Kapha, yeah. So they are predominant in their function. But if they came to you, either for me there are some patients coming, they are not patients even, they are the clients maybe sometimes very difficult patients also. Some patients come to protect their well-being, not to be, maybe 2-3 kilogram reduces, they are very fine, healthy, and to make a seasonal cleaning, they are coming and find their food regimen to the next season. And if they have any advice to in work, they are also asking some questions to me. So when they come, if a different new patient, we see from their what is the face expression and what is their gait. Yeah, we want to look to the gait, face expression, how they wishes you when they come to you, and what is the skin, hair, everything we look. Then that is the first thing, that is the obvious thing. Then we can make some inferences, of course, from that. Then we sit and we are starting the interrogation. Interrogation means question and answers. That is the dialogue. We are starting the dialogue, of course, where they come, how to know us, yeah, because it is not a common thing in Moscow also. In Moscow, maybe 3 or 4 Ayurveda, 3 clinics maybe, 2 of us, yeah. Then what they come, we can ask them some questions. That is, we are taking the symptoms and anamnesis, history of the disease. History of the disease, then we are going through the so many family history, personal history, emotional history, yeah, all the things, personal history. We are only going through that, and gradually checking the 10 factors. We will come to the 10 factors, what we are, Dashavida Parisha in Sanskrit. Then complete diet, advice on diet and regimen we are giving. We are giving the treatment plan with internal and external therapies and periodic follow-up. These are going on. So, yeah, I said you how we come to end diagnosis? I given you that question, I didn't get the answer, so I would like to answer for that. Any disease, any diagnosis is getting through the information through our sensory faculties. Of course, what are the sensory faculties? That is the eye, hear, yeah, hearing ability, tasting ability, and the nose and the tactile sensation. This is the same thing in modern medicine also. If you look through the microscope, you can come to the even to the cells, yeah, and the cell organelles. Then even strong microscope, even you can go to the genetic side of this, and what that is also the by the vision, but it is with a strong vision, nothing but, yeah. So the second one may be the hearing. Hearing we are using, yeah, the crepitus from the joints, yeah. We can sometimes we can hear the vowel sounds, yeah. Auscultation, the heart, lungs, we can assess. And even you see what we are doing, ultrasound. Ultrasound is a combination of tactile, because it is sound, it is also touching, sound is touching somewhere, touch, sound and vision. MRI also this combination. So anyway you think deeply, all the diagnosis is done by our visual perceptions. Without that we cannot do anything. Even we are looking to the biochemical testings. There are reagents which is touching there and also giving the results. Yeah, without reagents we cannot make a test, or with microscope or by reagents, touching and seeing it together. If you think deeply, all the diagnosis in the world we can do only through our sensory faculties. That is why in olden time Ayurveda used such sensory faculties more. Of course, today I had a questionnaire, yeah, and get some result. In the first lady, it is not completely correct, yeah. You understand, but because it was her perception, and we can look into a different level. That different level is the quality of the doctor. You see, a good doctor and usually all doctors are good, but a very good doctor and a good doctor, the change is very less. The very small difference. Occasionally, that small change make big change in result. So it is coming through our experience also. So this is that we are doing, and we can go through it. What is the 10 type of diseases, and we are saying about the ama. Ama, you see, ama, I told you, it occurs due to the improper digestion. Improper formation of ama is due to the, if some dosha is changing, because Agni is not really properly working, it localizes in the dhatu and forming the toxic substance. Toxic substance may be something peripheral. This is one more concept of disease in Ayurveda, and it's very important. It may be peripheral, like lack of appetite, and make bloating. So many patients has bloating. It is a first sign of so many metabolic disorder. Just they have excess gas in that. It is also a sign of ama. It is a very, what we can say, it is a not serious, but it gradually leads to serious problems. Even Ayurveda says it gradually, I think there are so many kinesiologists in this, they understand it easily, and some osteopaths, they can also understand easily. Because when blood the our stomach, it presses the diaphragm. Diaphragm presses even the phrenic nerve. Phrenic nerve goes the negative feedback, and it makes so many not a sudden thing, but gradually it makes so many problems. It says Ayurveda says anaha is the big gas formation materials. Yeah, it can gradually lead to the heart disease. In negative feedback, it can be a process, the anything can occur in our life. Yeah, it can gradually process and make the arrhythmia and heart diseases. It is true, but if we think a small thing, how to generate the problem in our body, it may be just a small thing, just bloating, and it can be corrected by normal, maybe skip one time food, or takes normal food, or take some digestive medicine and correct the digestion. It can be relief. But if it is deep, it can be a weeping eczema. It is one more deep one, and even deep they can cause the more deep serious problems like even cancer. Ama is a concept of metabolites which can lead a simple problem to deep problem like cancer. So ama can be structural, just like a kidney. You see the kidney calculi. It can be structural like atherosclerotic plaque. Atherosclerotic plaque is also a ama, because also derangement of the normal enzymes and adipose these high cholesterol plaques and making atherosclerosis in the vessels. And it may be structural like a disc problem, or it may be functional also. So what is the treatment? Simply, we are saying always simply, it is in every patient it is a difficult task. So I can say you, give you some my SP experience. Not it can be said with evidence, with clinical evidence. Yeah, that is evidence based treatment what we have done through Ayurvedic preparation and treatment. It may normalize those to very easy to say normalize dosha, to remove ama, to normalize agni and reinstate the dhatu. That we are doing. That is the again I am already talking you like Ayurvedic scholar students without terminologies. Dosha means you know already. Vata pitta kapha we told you. It is normalization of dosha is the first thing. Then it gradually improves the agni. When dosha normalizes, it removes the ama. When all the things normalizes, the dhatu or our tissue will be reinstate, normalizes. This is a balance. In so many diseases we told it is if the balance is changed, just like balance. If the balance, there are some schematic. I removed so many slides from me because it is difficult to tell you, and it may make elaboration, because I would like to give you some concept of Ayurveda, how it works, what is the basic concept. So these things if you see there is a balance, just right, if maybe it is like that, a separate angle, we can come it to normal, we can come it. But in some cases, if it is like this, of course, in some cases it is come, or it may only come like this. So better to make disease chronic. It is not only by the patients, but some disease courses is like that. For example, it may be a fantasy for you, for the modern doctors. For example, if Ayurveda says, if rheumatoid arthritis or serious disease, such autoimmune diseases, if we correct in the first year, if the patient comes as early manifestation, you can completely remove it, and even we can erase the disease memory, autoimmune bodies disease memory. And you see, even up to 1960s, it was the modern medicine thinks it as a disease of joints. Then only the autoimmune antibodies invented. But in Ayurveda, in ancient time, it think as a blood-borne disease. Blood means the blood, the circulatory immunocomplex. Now the knowledge only came later in modern medicine. So I am saying if the balance is important, and it is according to the disease and the course of disease. Of course, we say usually the disease course is very severe and very deep, very speedily occurs, just like a flood. It is very difficult to come normal. Usually, most of the disease just like a flood. It comes and it fills the lower plains, and if the flood goes in the lower plains, the water remains. That is the after effect. To the after effect, to re-establish what rehabilitologist doing. It is very difficult task. Ayurveda can play a big role in rehabilitation too. So this balance is very important, and Ayurveda doctor knows the balance. He can re-establish it completely. He can only manage it, or he can, of course, if it is a surgical thing, it should be, for example, it may be not be a surgical thing. Of course, most of the cancerous problems, better to remove it first by surgery, then to treat, maybe chemotherapy, anything. So the first thing is to find what is the after effect and to relieve it. So there are so many therapies, that is herbal. In Ayurveda, all the products, all the preparations are exclusively natural, completely natural. So it may be herbal origin, about 70% of it herbal origin. Sometimes it is mineral origin. Ayurveda uses all the minerals, metals also for the treatment purpose. So many metals and minerals have toxic effect, and Ayurveda is preparing it in a special manner. It is the old and ancient alchemy which is using in Ayurveda. Even I can say it is not very common, but there are specialists, they are using even very toxic metals. If somebody says in Ayurveda everybody is using toxic minerals like mercury, just like that. But there are so many processes to kill. This is in Ayurveda, in Sanskrit, there is a terminology known as marana. Marana means to kill the toxic quality of the metals or minerals and make it more therapeutic. And there are combination of herbo and mineral and animal origin. Animal origin is usually, it is usually the horns, yeah, and lymph, and some we are using some bouillon, some, yeah, from all these things, animal origin also using for Ayurvedic medicines. And you see, everything in nature is medicine. In Sanskrit there is a good word, Jagatyeva Anaushadam. In world, everything is medicine. In the medicines are, I already told you, different types. There are more than 50,000 kinds of natural medicines, combination by different companies. It is a big industry also. There are good companies, of course, there are not reputed companies. So, the Ayurvedic, already told you. And Ayurvedic pharmacopoeia, we can use a lot of parts and method of preparation for Ayurvedic medicines. That is, the decoction is the extracts, fermented decoctions, that is the Ayurvedic wines, we can say, because the natural fermentation is going on to preserve more period. And there is the fat formulation, that oil and ghee. Ghee is very important type of medicine Ayurveda. Mostly it is used by the cow ghee, that means the milk fat from the cow, and it is using to make so many medicines, because we have, it is one of the important thing in Ayurveda to do panchakarma or detoxification. And there are powders, that is churna, and tablets. There are very just like pills, round pills, natural, and now we are pressing so many. And there are so many volatile extract, that is distilled extract from the, it is not too bitter. And there are pure juices, just pressing the juice from the leaves, from the barks, from the roots, also uses, that is the Swarasa. And we are using the ointments and drops, eye drops, ear drops, nasal drops, all things are using in Ayurveda. So, how the drugs are injected to the body, except the parenteral, yeah, except the injection, Ayurveda doing everything, that is orally, nasally, through the skin by massage, because, and rectal, and it is through the stimulation of bioactive points in body. I can show you one of the slide in that. And you can say all the rest of the openings. It can be genitals, also using female and male genitals through it, also administering. It is not very common, but it is in special cases we are using that for treating the urinary problem or gynecological diseases, or in the uterine problems we are also administrating medicines like that. So there are special massage techniques, Ayurveda external therapies. External therapy is very important in Ayurveda. Usually we have so many herbal oils and decoctions and powders to administrate externally, because what is the biggest organ in our body? The biggest organ in our body is the skin. It covers so many square meters, yeah, so many square meters. So we are administrating the medicine. It is but not a big quantity, but it has so many effects. It is of course through the skin, it is directly going, and also it makes some special action in body. So there are special dharas. Dhara I will show you how it done. It is on the head, pouring of the decoctions and herbal medications and herbal oils on the head. And you see, the one of the classical Ayurveda medical massage with medical oil is known as Abhyanga. Usually it is doing 2 persons together. That is for hand massage. 2 masseurs, 2 massage therapists together. In India, in some clinic, one of the clinic where I study, there are 4 people together doing, that is 8 hand massage. So the Abhyanga has good effect on normalizing the body function. The oils are different, we are using different for different problems. Then the body heating through the balls. In the balls, the different composition. We are using herbal powder. We are using some medicated rice. It is medicated rice means the rice is prepared with herbal decoction, and and it is also using as a treatment purpose for, usually we are doing this for atrophy. For infantile cerebral palsy, it is a good treatment. This is the powder massage. This is the Udvartana, we say. It also improves the peripheral circulation, reduces the adipose tissue, reduces cellulites. It's also good cosmetological effect, as well as it reduces even very obese patients. We can reduce 500 gram daily if they have in good diet, and also we can reduce even 500 gram daily with this procedure. And it is also very good for improving the skin, to remove the different type of pigments like that. And this is the one of the classical treatment of Ayurveda is Shirodhara. Shirodhara is using for many disorders. It is a good treatment for the stress, those who have anxiety, insomnia, and some headache. So it normalizes the, usually we are done some scientific studies during this procedure and after that also. It normalizes most of the rhythm and the waves, alpha and gamma, beta. So these waves can be normalizes and more organizes. So many disorganized waves are coming to the organized stage. And it is very important, and it has also therapeutic and cosmetic, and it is also saying as a rasayana, or a very good therapy for the prevention. So nourishing eyes with medicated also ghee. It is not oil, usually you are using ghee. So this tarpana means to nourish in Sanskrit. It nourishes the eyes. It is a good treatment for them. There are different medicine we are using. It is a good treatment for the short sight, long sight, so many other difficult problems like retinitis pigmentosa. These things can be, it is before and after we are checking, and it can be established the treatment. And there are different comprehensive procedures to deep cleansing of the body known as Panchakarma. According to Ayurveda, the treatment is different, is divided into 2. That is the palliative care, that means all the therapies we are doing externally, internally, taking medicine, decoction, tablets, and doing psychotherapy. All these things is known as Shamana therapy. Shamana means is palliative care. So it is not a radical care. So panchakarma means the pancha in Sanskrit is 5. Karma means actions. That 5 action means 5 type of cleaning. 5 type of cleaning, it is the, before that we want to prepare the body with a special diet for 15 days. Minimum 15 days, 7, 15 or maybe 1 month. And taking some medicine to improve the digestion, digestive function and clean the channels. You have already the knowledge about the channels, digestion, everything. We are normalizing all these things, then giving special medicated ghee or medicated oil, increasing every day, and it, from 20 ml 7 days. More than 7 days not needed, because then it will accustom to the body. Before that it is taking the ama also you know the terminology, it is the metabolic waste. So how it takes, gradually increasing, it goes to the tissue, and this gradually saturating and going to the tissue and tissue organelles and taking the unwanted toxin, is make a conglomerates. And after that we are doing the therapies like so panchakarma is 5. It is either through the vomiting, either the very rarely it is doing in vamana is not always indicated, or by enteral, that means purgation, or it may be the enema therapy, or it may be the nasal therapy. Nasal therapy only not only to the sinuses, it has immense deep effect on the brain, because it is reflect, it makes some impact on brain also. It has general effect, because you know nasya is contraindicated in first trimester. In first trimester of pregnancy it is contraindicated, because it can even contract the uterus. And the next one is the bleeding. It is therapeutic bleeding. Therapeutic bleeding, there are different methods. There are venesection, there are leech, there are special scalpels we are using, and of course that is the main thing. With the panchakarma, Ayurveda says we are rooting out the disease. In most of the chronic disease, I told you, Ayurveda can treat, and even we can manage most of the chronic disease like rheumatoid arthritis, Crohn's disease, ulcerative colitis, just like serious disease. This disease and metabolic syndrome, most of metabolic syndrome we can correct. And if diabetes, if it is not too deep, we can also change the patient to the normal way. We can remove him from the disease. So this chronic disease, which in modern medicine there are no treatment, we can manage by the panchakarma. That is the reflexology, means special Ayurvedic marma therapy. Marma therapy, there are 107 vital points are described in Ayurveda. It make so many disease effect and therapeutic effect in body. So Ayurveda is using for that therapeutic. And therapeutic exercise means we are using that, very important. For the headache, usually it is tension headache. Maybe usually it is, we are putting the 3 fingers. This is the orientation. Usually the orientation we can find by our size of fingers. Of course, somebody has big fingers, very fat, yeah, according to anthropometry. So these fingers we are putting this and finding the orientation. So this is usually the temporal suture, and we are doing 3 strokes there, and should be given in normal pressure. Should be too much, not very late, but for each and every patient, by pressing the fascia, skin, under that fascia we can find the what pressure should be done for that patient. So, then we are just removing this area. Then here is also one marma or the vital point. This vital point we are stimulating. So, the drainage started to comes. So many patients taking analgins or Nurofen, yeah, they are, if they are coming to me. So, for the Ayurveda has good treatment for the headache, not only reflexology, mainly through the nasya and through the some medication, correction of bowel habits. So many headache from bowel. So this is the tension headaches we are usually removing. There is the third marma, vital point is here, stimulating it, and there is again 3 fingers line also stimulating this area. Then here where we have the fontanelle, closing of the fontanelles, yeah, just before that anterior fontanelle we are making a this is, so we are also frontal suture here, also in between parietal and frontal there is a suture. So this knowledge is in Ayurveda marm therapy, and after that we are going to this area. This is the occipital, and putting a support here and putting an anchor or fulcrum, a leverage, giving leverage to here and making also releasing the sutures of the occipital bone, temporal, frontal and occipital bone sutures we are releasing. If the pressure is not too deep, then we must lift this place and put for that time, and this area should not be done, but we make some air breakthrough through this area. Usually when we open all these, the patient usually feel very fresh.
Yes.
You feel very fresh.
Yes.
She is very a friend of me yesterday. She helping me, but usually
Yes, it's true.
yeah, most of the patients, and here is amsa marma. Amsa is the shoulder. So this place, if he has any trauma, it can be, it is the branchial plexus is going through that, according to you have the anatomy knowledge, yeah? But here we can make some effect on her neck. So her back pain, this area come from the neck. If we release this place, she have a this the knowledge of these points. For these points we are usually, for example, one more marma for now we reduced her, she more fresh, you see her eyes become more wide after this procedure, yeah. So there are another procedure to sleep more. Those who have sleeping trouble, we are using some more therapies. Maybe it is if you do 7 times every day, 7 days, the most of the sleeping days, of course, if there is so many tensions like that, is persisting problem, yeah, we want to remove it, yeah, and we are for the physically we are doing to make them more relaxed and getting sleep and getting sleep easily. So many items and so many therapies which is removing you have knee joint pain, but we need a small place to lay on your belly, yeah.